Hello, everybody. Thank you for taking the time out to watch my presentation. My name is Latashiana Lucas, and my presentation is over autism spectrum disorder. Autism spectrum disorder is a neurodevelopmental disorder where there are impairments or irregularities in the growth and development of the brain. Autism spectrum disorder includes conditions such as autism, Asperger's syndrome, childhood degenerative disorder, and an unspecified form of the pervasive developmental disorder. 1 out of 68 children tend to have this disability, and it is making a high occurrence rate since 2012. Having a disability already makes it harder for you to do things in your everyday life, and autism spectrum disorder is one of those things. Autism spectrum disorder came about in the late 1900s, and it was seen by plenty of scientists, but back then they can't really put a name for new things. So then they would call autism schizophrenia because all the symptoms they had of each other. So then this disability also occurs with many other medical conditions as well, like things with tuberous sclerosis or congenital rubella syndrome. So they would see people with ASD with these also other onset medical conditions. So like if you have something like this, it was known for you to have ASD. This disorder alters your brain functions, make it harder for the average person. It's difficult for you to socialize with others. Doctors came up with a manual that will help diagnose this and to give the reasons why the person will act and feel as they do. And the manual included signs and symptoms to help diagnose ASD. Autism can occur from genetics, but that's not the case for all individuals. There are many theories that ASD has come from a combination of different vaccines like the measles and flu shots and things like that. Having this disability can make it hard for the individual's use of daily brain functions, and symptoms normally develop before the age of 3. But considering that every case is different, ASD can occur to anyone at any time of age. Autism cannot be a prevented disorder only because this is a neurodevelopmental disorder. So basically, this disorder is best controlled when it is caught in the early stages. So a doctor catching a child before the age of 2 will have a better chance of a child that's already in elementary school with this disorder, because the child before could easily figure out how to manage it and there's a better chance of controlling it. But a child in elementary school that's already been like without the disorder will have to figure out a way to learn how to manage it quickly while they're in school, and you don't know how severe the case may be as well. So the best thing with prevention is to keep a close eye on your child. With noticing any weird patterns, you want to take your child to their primary care doctor. So if you see anything weird, just make sure you take them to see their doctor every now and then. Some signs and symptoms with autism spectrum disorder is everything is different in this case. Having problems with communicating is a common one, and also the behavior around others. With this disorder, some signs might come as early as the age of 6 months, and others can come later in life. Parents will notice things within their child that aren't normal, as if they don't answer to their name or they have poor eye contact. Parents can also notice the lack of interest that their child will have in how the unit. Oh my God. Parents also notice the lack of interest that their child could have in how they have different unique patterns in their behavior. So like instead of having desires to play with dolls, they would do other things like slapping their hands on the desk or wanting to bang their head. It's just different little things. Like they don't answer to their name, they're not showing too much eye contact, and sometimes if your child does not speak at all for like I believe it's at the 16 months, you want to take your child to your primary care doctor. So some diagnosis, this cannot be cured, but they have several medications to help with diagnosis. The child or the adults, they already do regular checkups, so they will notice when something is different within the person. When something different or unique is seen, they use DSM-5, which is a manual to help diagnose this disorder. It came about a long time ago in the late 1900s, where it started off as DSM-3, but it updates throughout time. It updated around the 1999 to 2004, and it has certain steps of symptoms to follow to let you get the correct diagnosis, to let you know if it's autism or Asperger, the other things that I listed in the beginning of the slideshow. Certain medications can only help with onset conditions that could happen with ASD, and the diagnosis team of therapists and doctors all come together to help out the individual. The prognosis, every case of this is different, so you're going to get a different prognosis depending on the case. If this disorder is caught way earlier, it is likely the individual will learn to control it and be with their regular age group, normal classrooms, can live on their own. It's also hard because some cases can be severe than others. Mainly, the only thing to help will be giving medications to slow down the other onset conditions that come with this disorder. So, like I said, depending on how severe the case is, they might not be able to go on with themselves and live their normal life. Some might have to stay with their parents. There's some grown adults still living with their parents, and their parents are old, so they have assistants helping them as they go on with life. So, like I said before, this disorder, if it was caught way earlier, they can learn to control it. Like a 4 to 6 year old, if they learn to control it, they'll be okay to go with the original age group. It's just all about when the disorder is caught and really how severe the disorder could be. So, for the prescription, there are many things that can be done to modify things for the individual. So, like, in PE class, having stations or follow the leader games, allowing them to move on their own, them having that privilege. So, like stations where they could choose where to start, but they are getting the full concept of the lesson. They're picking where they want to go, the things they want to do, but they're going to do all of them. Those with ASD have problems with being social, have problems with being social. We could do an activity where they have partners, they meet new friends in class, they're not just talking to the same individual all the time, or just their para is always someone new in the class. You can have limits on the activities or changing the level of difficulty of them from easy to hard. And because there are other onset conditions, you might need to lower a net, change the speed of the game, and also have positions so they could play as coach or adding extra steps for them to catch on to the game. There's plenty of things that you can do with this. So some support. An individual with disability really needs someone on their team to care and to help them out. Someone on their side to help encourage them with things. Everyone in the family helping out as well. When they're diagnosed, they have a team of doctors, therapists, speech doctors just to help them, and some helpers at the school, and meeting new people also helps out. After a while, they will grow out of being distant and want to talk to others and meet new friends. I have been blessed with the opportunity to do observation hours with those who have disabilities, and I have seen a few individuals who have ASD. And as they are older, it seems like they are so much comfortable talking to others. And I actually seen one who doesn't want to speak at all, and she was kind of distant. So I tried myself, being nice, trying to be there for her while they were playing basketball, and she actually came out of her shell. So that's how I know being there for somebody, it actually helps, and it's really heartwarming to know that just you being there for somebody or trying to help them will actually bring them out their shell. So within the conclusion, growing up with any disorder can be challenging. You have to change so many ways to get some things done, and you have to help and have a great support team. If you know someone with this disorder, now you may look at things differently to see how you can be a better friend or just help them in general. Learning more about this disorder should help as well. Now you know ways to modify things for them, what to do as support, how this happens, what to do to help, not prevent it, but, help it all in the all. So, thank you for listening to my presentation about autism spectrum disorder. My name is Latashiana Lucas.